Hello and welcome to the Arise interview. 60 minutes of big questions about the big stories from the news and beyond with fresh insight and critical analysis. I'm Stanley Okolo. Coming up in the next hour, there's a growing chorus of international criticism against President Trump's decision to suspend funding for the World Health Organization, while coronavirus infections are still on the increase. The UN, the EU, Germany, Russia and Bill Gates have all criticized the move. And China has said the WHO played an indispensable role in the crisis and Washington should fulfill its obligations. So is Mr. Trump finger pointing to shift the blame away from his administration's handling of the outbreak? We'll speak to the Director General of the West African equivalent of the WHO. And later, as governments and health officials battle the spread of the coronavirus around the globe, could the crisis create an opportunity for positive change in Nigeria? Well, the governor of Nigeria's central bank has delivered a long speech with a central message that Nigerians should start looking inwards to guarantee food security, high-quality, affordable healthcare, and cutting-edge education for its people. Given that such change has been paradoxically slow in Nigeria, will COVID-19 make a difference? We'll have analysis of Godwin Emefiele's speech in a moment. For weeks now, President Trump has been criticizing the World Health Organization for its handling of the coronavirus outbreak. Last night, he accused the WHO, which is the UN agency that coordinates international health policy, of severely mismanaging and covering up the spread of COVID-19 because of its bias in favor of China. He said his administration would halt funding for the WHO while a review was conducted. But in a swift response, the UN, the EU, Germany, Russia, China and other world leaders, as well as doctors, diplomats and Microsoft founder Bill Gates, have criticized and attacked Mr. Trump's decision, saying that withholding money in the middle of a crisis will help no one. Already some European countries and other nations are looking for ways they might fill the gap. Here's what Mr. Trump had to say at the White House.
Today I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. American taxpayers provide between $400 million and $500 million per year to the WHO. In contrast, China contributes roughly $40 million a year and even less. As the organization's leading sponsor, the United States has a duty to insist on full accountability. Since its establishment in 1948, the American people have generously supported the World Health Organization to provide better health outcomes for the world and, most importantly, to help prevent global health crises. With the outbreak of the COVID-19 pandemic, we have deep concerns whether America's generosity has been put to the best use possible. The reality is that the WHO failed to adequately obtain, vet, and share information in a timely and transparent fashion.
Donald Trump. Well, for more on President Trump's move and to assess the WHO's record so far, I'm joined now from Ouagadougou, capital of Burkina Faso, by the Director General of the West African Health Organization, WAHO, Professor Stanley Okolo, and he joins me via WebEx. Professor, thank you very much indeed for joining.
Before we start, can I correct two impressions? Number one, I am in the second largest city of Burkina Faso called Bobo Dioulasso. I'm not in Ouagadougou, which is the capital. Number two is that we are not the West African equivalent of WHO. Nobody can supplant WHO. WHO has a tremendous work to do across all the 194 member countries that subscribe to WHO. The ECOWAS, Regional Economic Community, cannot supplant the United Nations. We all work together to improve the health of the population.
Right. I don't know if you actually got my initial question, because I think there was a problem with the microphone. But my question was, what is your reaction to President Trump's announcement that he's freezing US funding to the WHO?
The first reaction that we have is one of disappointment, given the history of where we are coming from. Please do let us remember that the American government have been very key, the single government that have been supporting the WHO tremendously across the years. Last year, they gave about $513 million to WHO. Their assessed contribution was only about 111, and therefore they gave 4 times what they were assessed in terms of voluntary donation to WHO. So that's the first reaction, the fact that a government that has supported WHO so strongly that it might be looking to reduce its contribution at this time. I am not interested in the justification. I will only be interested in the impact on our population in West Africa.
Nevertheless, you are someone who is of international background, and the role that you play has international tentacles and international implications. Do you think the US president is criticizing the WHO for the very same mistakes he made and trying to shift responsibility in what some say is a very misguided and very self-centered decision?
Charles, it will be extremely self-centered of me to understand why the president makes the decision he makes or to ascribe any motive to that. What I can say to you is that from where we sit, the efforts, the influence, and the impact that the WHO has had, particularly in Africa, with a lot of low-resource countries and a lot of countries that do not have the capacity not only to develop technical guidance, to develop health systems, to understand what is necessary to do at different times. And in fact, let us also think about how American funding has been supporting most of those other non-core activities of WHO, be it to do with non-communicable diseases, communicable diseases, HIV, TB. Most of these we will now have to look for additional funding for. So it is not for me, and it will be self-centered of me to even attempt to ascribe a motive to what has happened. And again, I say, everybody makes mistakes. The WHO was criticized for its slow reaction to the Ebola we had in our West Africa region in 2014. But they have been working to try and review that. The time for review is after the crisis. And that's why we are pleading that for us in West Africa and for our countries that are challenged by various maladies and including the issue of security, we don't have that extra funding to plug the gap, and the impact will be detrimental.
Nevertheless, as you pointed out, we are where we are. Do you think that beyond the crisis and all the reaction to it, Donald Trump has a point with regards to the WHO?
Again, you know, it is really important for us to keep our eyes on the ball. At this point in time, our eyes are on how do we maximally test people so that we know those who are positive for coronavirus and then ensure that we make sure that they do not infect others. How do we assure getting critical medical supplies to our region and to other countries? How do we ensure that those who are unfortunate to be affected and are ill in hospital are looked after using scientific guidelines, often developed by WHO? How do we get the equipment and material, including ventilators, oxygen concentrators, oxygen masks, to look after them? How do we protect the hospital and healthcare workers who are looking after them? These are the key things that are engaging us. We have a disruption of the global medical supply, really going into what mistakes or missteps we have made along the way when the crisis is still on. I think it's not the time for it.
Point, though, I mean, your point is obviously well taken, Professor Okolo, but the point of Donald Trump is basically that in order to go where you're talking about going, you have to look at where you're coming from. And even though many American public health experts believe Mr. Trump's own handling of the pandemic in the US has been lamentable, many other public health experts are also raising questions about the way the WHO was perhaps too trusting of China, too willing to take Chinese claims at their word at the early stages of the crisis. Is there perhaps a lesson for you yourself there, Professor Okolo, in trusting what governments in West Africa tell you, for instance, about an outbreak, rather than, not taking them at their word and doing your own investigations?
Well, again, I'm working with 15 countries. Apart from the lockdown, and even with the lockdown, we are looking at humanitarian corridor. I would be in each and every country that I'm working with if there appears to be a problem. And of course, we do speak to the ministers all the time. And so we have this communication, collaboration, and coordination. That is only 15 countries. That is not even 10% of the 194 countries that WHO has to look after. But let us really look at this critically. If you really were to go and say you want to do an investigation or a review, Charles, look, it will take 4 weeks, maybe 6 weeks before you empanel the people. The people will look at the information and then they will come out with a decision. How many people will die? How many more cases will we have? How can we support even those at the moment that are dying from non-coronavirus illnesses? The United States of America has been a friend to us in West Africa. The USAID has been the oldest supporter of WAHO, my organization, as far back as the first years of WAHO. So the United States government has a role to continue to play in supporting, and it's that impact that I don't want to be lost.
Okay, please stay with us, Professor Okolo. I'd like to talk with you a little bit longer. You're watching the Arise interview. Plenty more still ahead as we continue our chat about the decision by President Trump to halt US funding for the World Health Organization. Stay with us. And still with me from Burkina Faso, the Director General of the West African Health Organization, WAHO, Professor Stanley Okolo. Thank you very much indeed, Professor, for staying with us. So the general feeling from all the reaction we're hearing around the world seems to be that the timing of this US move is very unfortunate. Whatever China may or may not have done, China is essential in providing the supplies of much of the equipment and maybe ultimately supplies of a vaccine. Who knows? So now is clearly not the moment for this kind of rancor, and you agree with that?
Yes, I agree. And the other thing I really want to bring out is that if you look at the pattern of this pandemic across the world, different parts of the world go through it in their own phases at different times. And here in Africa, in West Africa, we are still at the beginning. So you find that countries like Spain and Denmark and some other countries are thinking of when they decide to relax some of the lockdown. We are still at the beginning phase. So overall in Africa today, we have only about 15,000 cases. In our region, in West Africa, we have only about 3,700. I expect this to increase and increase much more before we then get to the phase whereby we start containing it, and some of the measures and the social distancing and the participation of the public in the public health measures and processes will kick in and the impact will start going down. Don't forget also that this is a virus, and therefore, when people have it, it has a time span during which most people will recover. Unfortunately, some might die. Now, so it is particularly impactful to us in Africa at this time. Even if the American president, from what I read, obviously what we see on the news is a news clip, but from what I read, this is a suspension for up to 90 days. Even if it is that, it is going to really affect us unduly. And that's why we are pleading from Africa that he should reconsider.
Let me just move away from Donald Trump and the World Health Organization to an area, obviously, where you have great expertise, which is, of course, dealing with the outbreak in West Africa. And the fact that we're hearing, I mean, a lot of people, I don't know, you're probably across some of this, but a lot of people are wondering why, in spite of the low testing in countries like Nigeria has only done about 5,000 tests, whereas, I mean, other countries have done tens of thousands of tests, even in Africa, places like South Africa. And they're wondering why we're not seeing more cases of people simply dying from coronavirus in Nigeria, for example, or more people turning up in hospital because they have diseases that they don't know what it is, and more health officials, medical staff catching the disease. Is there some sort of logical explanation for that?
Well, not really from where we see it. From what we see across some of the data that we're looking at, the mortality in terms of people dying and the people that are much more vulnerable appears to be similar to what has been noticed in other places. So, for example, with our very small numbers of people that we have in terms of our data, we know that the mortality in terms of, if you look at who are the people that have comorbidities, it's about 91, 92%. So they are older people. The average age from those we are looking at is about 60 something. Again, for West Africa, I'm only talking about West Africa. And then if you look at the other people who have hypertension or diabetes. However, one of the things that I think is what is showing different trends in our countries is that the moment you increase contact tracing and testing, your figures will increase. The second thing that we are now tracking ourselves is that we are also tracking not just your ever confirmed. So all the things you hear are usually the cumulative cases. But we are now looking at what of those that have recovered. So how many active cases do you have? So that's another thing to bear in mind. And then finally is to say that, yes, we have seen some movements. At some point, Nigeria was about I think the fourth or fifth in terms of high burden countries. No, it was about the fourth. Now, before at some point we had Burkina Faso as the highest burden. Now we have Cote d'Ivoire coming in as the highest burden, with Ghana closely by. And then we even have within that Niger and Guinea coming on as our high burden countries. We have 7 now out of the 15 countries. But another aspect that we also have to think of is how do we ensure that the low burden countries don't become high burden? So how do we also support them whilst we are continuing to give support to high burden countries?
And of course, all of that takes us back to the crucial issue of funding. And just to return to that nettlesome issue of Donald Trump and the WHO, I mean, you know better than most how these funding situations work. Can we assume that in terms of pure funding, the WHO will already have the money for this year, so it won't have an immediate direct impact on its operations this year?
You know, really, honestly, I don't work for WHO, but if you look at what is coming out of WHO, I doubt that it would be comfortable if we can say that. But I do doubt that. You know why? Because about 3 or 4 weeks ago, the WHO Director General said they required an extra $650 million, not only to support countries, but also in order to fight this coronavirus. It is not just in terms of the training they're doing, It is in terms of the humanitarian corridor that they set up. It's in terms of the support that WHO occasionally give to countries. And it's also in terms of continuing what you might call the day job while redirecting efforts to a pandemic. So there are still programs on HIV, on immunization. Children are dying, women are dying in childbirth, and WHO still has to support us in this. So I really doubt that this interruption, because the budget has already been made, that it will not impact on WHO. I think it will. I think it will. And so I give you an example. For us here in West Africa, we always get a lot of generous funding from our partners. West Africa Health Organization is one key institution of ECOWAS. In fact, is the highest partner-funded institution in ECOWAS. And even with this, some of our partners immediately stepped up to the plate and increased the funding dedicated to coronavirus. At the moment, what we are seeing is that some of the things that we were able to purchase 2 or 3 weeks ago, the prices have all gone up because everybody is trying to buy them. You can't even find enough ventilators to buy. And this is because, of course, the pandemic is affecting a lot of the Western countries that produce this. WHO has to balance all this. WHO has to work with all this across the world. We are only working across 15 countries, and we see the complexity and the difficulty that we are in. But we are sure that we will get past it, provided the measures that are in place, the public continues to support the individual national government. And you know what, Charles, I am really proud of what you are doing at Arise and also what other media houses are doing to debunk rumors, because that is very bad in terms of managing this epidemic. So really debunking some of those fake news and rumors that are dangerous on social media and challenging them. That is what we expect of the media, and I'm very grateful that you're doing that.
Okay, we've got about a couple of minutes left, and we appreciate the time you've given us, Professor. This is, of course, the WHO, an organization that's, as you said, working to combat everything from measles and tuberculosis to malaria and HIV/AIDS and other diseases, which affect sometimes just the poorest countries on the planet. So it must be very distressing for people like yourself who've worked in those campaigns to hear the US president, the leader of a superpower, talking in this transactional manner and implying that because we are your main funders, you must do what we want, which is of course not the way the WHO or indeed any UN agency works, is it?
Charles, you know my antecedent, you know that I spent over 30 years of my professional life working in the West. And I came back only 2 years ago to work across West Africa. And really what I have seen and the need and the poverty, the socioeconomic determinants of health, how high they are, the impact, in fact, of every single dollar in improving health. And when you look at the misery on the faces of the population and their happiness when they can get any support or grant or funding, that makes us go to work every day to try and do the best we can. And really, it is not the time to start thinking about reducing funding, which will impact these poor people. Let me just leave you with a couple of statistics.
Professor, I want to thank you very much indeed. Professor Stanley Okolo is the Director General of the West African Health Organization, WAHO, and he's talking to me from Burkina Faso. You're watching the Arise interview. Plenty more still ahead, including as the governor of Nigeria's central bank lists post-pandemic measures he thinks could transform the country. We ask whether COVID-19 presents an opportunity for change. Stay with us.